See if I can do this while my car moving, man. Y'all don't know me, like my car be making the phone fall and everything, man. I was supposed to leave to work. I was supposed to leave my job early, but they had some in-service for respiratory care week. And what do you know, man? Out of all people, the lady want me to be her assistant to come help her, man. Y'all know I'm up there like, I'm up there just messing around. She brought in donuts. Well, hey, man, thank you for the donuts. I appreciate this. I'm eating. I'm having fun. You feel me? Like, I gotta get up out of here. So, since you're getting up, can you come please be my assistant? I'm like, all right, then, man. You feel me? I'm like, dang, I'm supposed to leave 30 minutes early. I don't left 30 minutes late. Damn, man. But last night, damn, hold on. First things first, bring it back. I gotta do that intro. Bring it back. Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. What we represent, man?
Big Money Bound.
So let her know, man.
Big Money Bound.
The kids, man. We got the kids, man. I got a video right here I was working on. I'm gonna touch on that in a little bit. I'm gonna let y'all know what this is. And then right here, let's see, got everything that happened to me last night. I got this right here. Let me get a little glimpse of this. Let me get a little glimpse of this first. Let me get a little glimpse. Get a little glimpse of this right here. I shouldn't be doing this while I'm driving. Ain't no guts, no glory. No, I'm messing around. I'm in my parking garage, so I ain't tripping. Let me stop and look at this real quick. Alright, so I can't even say I had a heavy workload. I had a normal workload, man, because as of lately, all the assignments been pretty heavy, man. So I had like 9 vents to take care out of the gate. 9 vents. 9. You normally get 5 to start off. I had 9. So you should know what kind of situation this was, man. If we normally get 5 and I got 9 to start off with, you feel me? Not knowing what's coming through the door. So I get report. And I get the report. And I just double check throughout the department. Hold on, bro. Hold on, baby. Come on now. Drive like you got some sense, man. Let me enjoy my Benzito, man. It's always people in certain cars want to drive crazy. Just certain cars that drive crazy. I realize that, man. So I used to be one of them crazy driving folks, man. But so I'm walking around the department, around the unit, making sure everything where it's supposed to be, making sure my vents is all plugged in, just doing a double thorough assessment, just checking out my machines. I run into a nurse. It's all like, hey man, they scheduled the CAT scan for 8 o'clock at night, 8 p.m. All of a sudden, it's 7:30. I'm busy. I haven't did one vent check. Would I leave my patients at 8 o'clock and go downstairs to CAT scan? Is that something that I should do? I haven't seen no patient I got up here checking them wires, ventilator documenting, seeing where they're going, breath, sound, suction. I ain't did nothing so far. Should I just leave and go to CAT scan? Because I got a CAT scan order? At 8 o'clock at night? Please drop the comments. Would you go down there? Or would you first do at least one round of assessment on all your patients, document all your patients, vent settings and everything, document on every patient, then go down when you finish? Is that a little bit more safer? I'm going down, I ain't did no vent checks, no nothing on nobody. I don't know nobody like baseline when I come in. I'm like, hey bro, yeah, I ain't gonna be able to do that, man. But what we gotta do is we should just reschedule. We'll be able to go before 9. I'll be done before 9. And we can just reschedule. And I'll be ready. He's like, all right, man. All right, I'm like, yeah. I don't know why they ain't do that on day shift anyways. Like, you leave something for 8 o'clock at night. Like, people just be putting stuff off, man, on the next shift. He's like, yeah, man, they should have been to that. It's what, it's 12 o'clock. This and that. I'm like, all right, bro. You got a point. As long as me and you on the same page. Now it's 7:30. All right. I'm walking around doing my vent checks, you feel me? And like, as I'm doing my vent check, I'm coming out of one room. I remember it was a time that I used to be like nervous and afraid to talk to the doctors. I come out of my room now. The doctor is like, it's a doctor, a resident, and like nurse practitioner doing their roundings. He's like, oh, here's the respiratory therapist right here. I'm like, what's happening, doc? What's happening? What's going on? I'm like, what's happening, doc? What's going on? I'm telling the doctor what's happening. What's going on? I don't got so comfortable, man, that like I'm talking how I normally talk out here in the streets, man. What's happening, doc? What's going on? Bro, you can't be doing that, man. I'm like, oh, and the doctor was like, oh, okay, hey. I'm like, no, I gotta tone it down. I gotta chill a little bit. I gotta tone it down at least just a little bit, man. Cause I'm tripping, bro. But like, I remember at the time that like I used to be nervous to interact with the doctor. But that's why last night I came up with a video idea that I'm gonna address the topic of like how you get over the shyness, the nervousness, like what you do to like break the ice, how you communicate with the doctors, like how you get comfortable being a real respiratory therapist that gotta communicate with the doctors on a day-to-day work basis. And just so happened, I had got a comment on one of my videos that was saying, can I give me any tips, any pointers about how to communicate with doctors during like clinicals and all of that stuff? Because like they very nervous and they scared. I remember that feeling, so don't be embarrassed by being scared or nervous. I was that same exact way. Plus I got anxiety problems, no matter how I was talking. You feel me? So I'm gonna go ahead and make a video for that. When is it gonna be out? I don't know, man. I got a lot of videos scheduled, so I don't know, man. I ain't gonna lie, but it's gonna be out. I can't even say. Probably it's gonna be in 2020, hopefully. I got so many videos, I don't know. Nurse hit my phone up. Hey, Randy, did you get that blood gas that was ordered at 7:30? It was a stat ABG. It's like 9:45. I'm like, I ain't get that, bro. I ain't get that order, but I'll go ahead and do it since you're telling me about it. I don't mind go ahead and do it. Okay, I'm gonna put the order back in. Bro, I'm gonna re-enter the order. Bro, there's no reason to re-enter the order. Like you said it was in there, I ain't see it. I'm gonna come do it because it was put in. Yeah, I'm gonna re-enter it. It's your world, dog. Just do your thing, dog. I ain't finna stop it. You wanna re-enter it? Go ahead. Or you wanna type it up? Every day I'm typing, just typing. Go ahead and do your thing, man. So she typed it up. I came and did the blood gas. The blood gas was like respiratory acidosis and metabolic acidosis. It was a mixed acidosis blood gas. So I go take the blood gas to like, it was a resident. I take the blood gas to the resident said, resident asking me questions that like, I can't give a pinpoint answer to, you feel me? All right, so she's like, what should I? Nah, the resident asking us, since y'all watching it. The resident asking us, so what should I do with this blood gas? What do you think I should do? The bicarb is 17. The PCO2 is 60. The overall pH is 7.05. Bro, what the hell should I do? Okay. Bicarb is 17. So we in metabolic acidosis. You gotta give bicarb. You gotta give bicarb. Dog asking me. So then let's say the resident asks you. So if I give 2 ounces of bicarb, what is the bicarb gonna go up to? I can't give you that answer, bro. Like that's something I don't. Bro, how the hell can I give you a pinpoint answer on that? I'm like, the dog looking like she really don't know. Like, I want to know, like, what happened? I'm like, man, what you're going to have to do is once you get a bicarb, I can't say an exact number it's going to go to, but I say it's going to go between 19 and 21. 19, 21, 22. But once you get a bicarb, the CO2 is also going to increase. So we're going to have to increase the rate as well. All right, what do you think we should increase the rate to? So basically, dog, I'm playing a therapist and I'm playing a doctor. I got no problem making my own orders. That's cool. As long as you put them in, I'll tell you what to do. You feel me? That's what we did. And I was explaining to her like, well, we can't really like say exactly what it's gonna do, how it's gonna do. We gotta really like administer, like make these changes, and then like see what's worked as we go. Reassess the situation. Come back and get a blood gas an hour later. See what happens then. Get an hour later. We gotta see like if what we're doing is working. You feel me? Like Like I said before, like all this is like practice. Nobody has like an exact number. Okay, you put this, you put that. If that was the case, wouldn't be no need for no repeat ABGs. We'll never repeat ABGs if that was the case. So I'm like, yeah, it's like you gotta more like yeah, you gotta see as you go. This is like see as you go thing. She's like, okay, you know what? That's a good idea. Let's do that. Let's get a blood gas an hour. Hey man, no problem, huh? And that got a lot to do with it too, man. Not even like, I ain't gonna say you gotta present yourself like you're a smart therapist. If you present yourself, you know what you're doing. You understand, like I said, understanding ABGs and how to fix them. Bro, that's 75% of the battle right there, bro. Knowing ABGs and how to fix them, I can't stress it enough. That's 75% of the battle. That's what it's about right there, man. That's what it's about. It's been like showing that you're a real deal respiratory therapist, man. Speaking of real deal respiratory therapists, man, it's respiratory care week. Oh, my full-time hospital don't even recognize respiratory care week, man. Ain't nothing going on in my hospital. Ain't no banners, ain't no nothing. Now, my director for our department, she does a little something for us, but the hospital, ain't none of that for you, dog. They had it 1 year when I was a therapist. My first year. That was the last year they did respiratory care week. The next year came, I'm like, they was having like some hospital week giveaway. So I'm like, what about respiratory care week? They're like, oh, we don't do that anymore. When I said I felt so heartbroken, bro, you thought somebody stole my puppy or something, dog. I don't know, if y'all follow me on Instagram, and y'all seen I put up a picture of what they gave me for respiratory care week, dog. There go the picture of what they gave me. There go the picture right there. Is this disrespectful what they gave me? Is this disrespectful? Drop down in the comments and let me know. If you had got that respiratory care week, what would you do? Please let me know, because I want to know, man. Please let me know, dog. Let me know. Oh, man. Oh, last night was busy, bro. I had like 9 vents. I had to do 10 ABGs come 5 o'clock in the morning, bro. 10. Hey, dog, I know I tell you about all the good stuff about respiratory therapy. You know, it saved me. It changed my life. It got me living. I bought a house. I bought the Benz. I got the dirty job Benz. Yeah, big money, bound. Yeah, bankroll. Hey, it ain't no peaches and cream, though. It ain't no peaches and cream, dog. I'm telling you, man. I'm gonna keep it real, dog. Last night I was saying all kind of like, this ain't for me, dog. I don't know about this, dog. Something gotta work, but this ain't for me. But nah, it's all good because I'm done with it. So it's only 12 hours. A few times, like throughout the shift, I had to help out a few nurses. One instance was where like they got an XLT trach and they got a decannulate trach. The decannulated trach is one that you put in and you clamp it. You squeeze it to take it off, and you let it go for the attach back into the cannula to what kind of trach is on. Am I making sense? It's like it's a clip on. It's a clip to clip. You squeeze it in to release it. You put it back and let it go to lock on. Now the XLT is different. The nurse was saying, Randy, can you show me how to like take this off and put it on? I'm trying to change the trach, but it's different from what I'm used to. I'm used to the ones that you gotta pinch. With the XLT trach, you gotta really like twist it off. It's like it's twist on right here. You gotta like twist it off and pull it out. But if you're not used to doing that, it's gonna be unfamiliar to you. So I had to show the nurse, get her how to do it. She's like, oh, okay, I understand. I can do it for next time. Thank you for letting me know. So I rarely do it and I rarely see it because at my hospital, my full-time hospital, and my per diem hospital, the nurses do trach care, which is a blessing for me because I'm not a fan of doing no trach care, bro. Can I do it? Yes, I'm a respiratory therapist, but do I want to do that? I ain't trying to do that, man. I ain't trying to do that, bro. I'm being real. I ain't trying to do it, man. I'm straight on that all. I never forget what happened to me when I was a student, man. The patient had a trach. Like on room air trach, trach was just there, room air vibing. Man, I was listening to breath sounds. I went over that dude's chest. That man coughed. All that wind out of the trach just flew on my face, bro. I'm talking about, oh, look, I was in there rubbing my face with alcohol for like 30 minutes, man. I thought they got me, bro. I ain't never go across no trach ever again. So, hey, if you watching, don't never go across no trach. I'm telling you, dog, be safe. On that note, man, y'all be safe. Have a good day, dog. I'm surprised I had enough energy to do a car talk, man. And this is my last and final car talk number 100. Thank y'all for rocking with me, holding it down. It'll be no more car talks after this. That is it, man. This is the last one. If you think I should keep going, drop the comments, but I'm not doing no more. But drop the comments and just show me love. Y'all have a good one.